Okay.
Good evening. Just going to let everyone join in, give a minute or so. I think we'll get started. Good evening, everyone. Welcome to tonight's Nutritional Considerations with Autism webinar. I'm Amy from PreviMedica, a division of Cell Science Systems. Whether you are a regular attendee or you're joining us for the first time, we're very happy to have you here for another information-packed session with Dr. Grabowski. And before we begin, just a few reminders. Tonight's session is being recorded. They'll all be recorded, and you'll receive both the recording and the slides by tomorrow evening. This webinar is not eligible for continuing education credits. If you have questions, please use the Q&A panel, and Dr. Grabowski will address those questions at the end. Recordings of past webinars are always available on the Cell Science Systems Practitioner portal under your account under your resource section. Now, to introduce Dr. Ron Grabowski, we all admire him very much, not only for his expertise, but also for his mentorship and generosity in sharing his knowledge. He has over 40 years of experience in clinical nutrition. He has shaped how so many of us think about personalized care and functional testing. There's so much more to say about Dr. Grabowski, but just here's a few highlights. He's a practicing doctor of chiropractic in Houston, Texas. He's an author of a clinical nutrition textbook and many, many articles. He has presented lectures all over the United States and Europe. He's worked with leading institutions like New York Hospital, Memorial Sloan Kettering, and MD Anderson Cancer Center. His research focuses on nutrition for the athlete, supplementation, and chronic disease management. As you know, if you know Dr. Grabowski, his expertise is amazing, but he also truly cares about supporting practitioners like us in applying this knowledge in our work with patients. So tonight, Dr. Grabowski will be diving into the nutritional needs of those with autism, and later on, I will touch on identifying adverse food reactions in autism. Thank you, Dr. Grabowski. Please feel free to get started.
Thank you, Amy, and good evening, everybody. And I'm excited about this. And the reason why this webinar is actually going to happen tonight is because of so many people that have contacted my office over the last several months regarding autism. And I was mentioning to Amy that, so many people are interested in this, and either they have a friend or a relative that has this condition. And you'll see why this is. And of course, as we know that these are kind of the general characteristics of autism, and you'll see in a few minutes, once again, that how frequent this condition is. Now, one thing that you will see tonight is how this particular condition is multifactorial, that there are so many things to consider with this, and there's no one answer to helping treat these people. It's interesting because when I was going into the literature over the last several months on this condition, there's actually some piece of literature that say this is not a treatable condition, that just forget it. If a person has autism, that's it, and they can't be treated. And I thought that's very interesting that someone would publish that, when yet you're going to see there's quite a bit of information on it. But there's a lot of things that we have to consider with this particular condition. And one thing I want to mention real fast is catching this earlier, preventing it earlier, or couples that that want to have children. It's very important that the mother and the father start getting treated nutritionally before they even have kids, because by the time that a woman finds out she's pregnant, she's already probably in the 5th or 7th week of her pregnancy, and that's when the nervous system really starts to develop and proliferate, and it's very important at that time. And you'll see that some of the nutrients we talk about and how that affected. And then if they are individuals that have an autistic kid, that it's not like, okay, forget it, my child's autistic, I'm just going to live with it, because there's some very, very interesting things that we're going to talk about tonight, not just from a micronutrient, but also when Amy talks this evening about food sensitivity and why it's important that, once again, we treat the parents to kind of head this off. If you look at this frequency of autism over the last 2 decades, it's kind of alarming. You can see back in 2000, 1 in 150 births ended up an autistic kid. And now here we are in 2020, and it's 1 in 36. So we're looking at almost a 5-fold increase in 2 decades. Now, the question is, why does this happen? Like I said, it's, multifactorial. There's several things that we have to consider. And I'm not really going to talk about vaccinations because that's not really what this is about. But once again, you all have your own opinion about that, and there's some literature about that, but it's one of the things that we have to talk about. Well, what about gender? Is there some higher tendency? Yes, it's 4-to-1, males to females. So we know that the male child is going to be more prevalent to have autism, but there's also certain things that we look at when we're looking at. So it's not just all genetics, which you'll see here in a few minutes, that there's, food tendencies, there's nutritional demands, there's certain nutrients that are more prone to be consumed in a female versus a male and vice versa and things like that. But it's very encompassing when you look at this particular condition. So you can see here, only about 10 to 20% of autistic spectrum disorder children, they feel, is due to genetics. And if you look at the other list here, these make up the other 80 to 90%. And some, like I said, I didn't mention, vaccinations here, but that's one, of course. But we know that there's certain statuses of the mother that, if she has hypertension, if she has diabetes, if there's any, infections and things like that. And of course, we're going to emphasize our talk today on nutrition. And you can see there's multiple things that we have to consider there as well. So it's not just like, oh, well, I tried that B12 on that person, it didn't really work, or I tried that vitamin D on that person. Well, yeah, there's reasons why some of those people are benefited, and there's others why they aren't benefited. So we can't just sit there and pigeonhole these particular individuals and say, this is a nutrient that's going to make your son or daughter better, because it's not that easy. And I'm not saying that because of those that I've treated, but if you go across the literature, and it's vast, there's a lot of things to consider, and it takes time. And that's the other thing that we have to emphasize to these parents is, we're not going to change the biochemistry of these children overnight. There's cases out there and studies out there where it took 2 to 3 years to really see some change in these particular individuals. And that's a long time. But once again, they have to realize it's not like take this pill and go, because it's not that simple. And so it's very easy to get frustrated from a parent standpoint if you have an autistic kid and you've said, okay, I've gone to this practitioner and they, we went to them for a year and we didn't really see a change. Or we went to this other one for 6 months. And yeah, because you're not going to really see a change. So look at these nutritional deficiencies that have been associated with autism. Protein deprivation, that's one that we'll talk about and how that really comes into play. And of course, some of the things that Amy's going to mention tonight as far as sensitivities and things like that, and how people start to pick different diets, or they follow different diets, and it can be an issue. Fiber intake is another thing. And this really comes into play when we talk about the microbiome. Okay, and we all know how important fiber is as far as a prebiotic and helping the microbiome develop. And there's a lot, as you know, with the microbiome and the brain and, the gut-brain axis and all that. Calcium, okay, iron, zinc. So I've picked out some of these today. There's no way, and I was telling Amy this today, and she knows as well, that there's no way that we can talk about all the things we need to do nutritionally to the autistic kid in an hour. especially when, I'm going to be talking about micronutrients, and then the second half of this webinar, she's going to be talking about the food sensitivities and things like that. But I am going to bring up some of these other things, that some of these nutrients and how they're correlated and how we look at things, and a little bit about genetic testing and why it's important and so on. And specifically like tryptophan, what we know about tryptophan and that particular essential amino acid and how important it is with these individuals. And once again, some of the things that Amy's going to say about food sensitivities and why some of these individuals are maybe more prone to tryptophan deficiency than some of these other amino acids. So when you go in the literature and you look at some laboratory diagnostics or testings, one of the things that we see with these autistic kids is in their blood, they actually have high serotonin levels, but in their brain, they don't have high serotonin levels. So here we're looking in one compartment and we see one finding, and then we look into these other compartments and we see a different finding. So this is why it's very important when you read the literature is to see, okay, why is this happening? I'm going to show you why that actually happens. There's some mechanisms that I'm going to explain and so on. Looking at glutamic acid, look at GABA. And a very interesting one, of course, is homocysteine. There's some studies that are done out there that are showing homocysteine levels are elevated in autistic kids. They actually only looked really at B12, folate, and B6. So of course, there's a lot of other nutrients, as you know, that manipulate homocysteine. But the point is that here's a common marker, pretty common marker now compared to say 30 years ago, that, when people look at homocysteine, it's like, oh, vascular, cardiovascular, stroke. Now we're looking at, of course, Alzheimer's and homocysteine. Now, of course, we're looking at homocysteine and skeletal development like osteoporosis, osteopenia. And now we have a question of homocysteine levels and autistic kids. So if you treat autistic kids or you're looking at some laboratory findings that you want to evaluate, this is one that's very commonly, it can be obtained, and you can look at it and say, okay, now I need to know why homocysteine is elevated. What particular nutrient? And through my section tonight, I'm going to talk about certain nutrients that are involving homocysteine. It's not just the B6, the B12, and the folate that most people are associated with. And of course, I always tell people that that's the big three that everybody looks at. And if those are normal, then homocysteine should be normal. Well, that's not the case necessarily. So once again, these are some of the things that are being looked at in the scientific literature and finding different levels and finding benefit when some of these levels are normal and when we can increase that as well. So this probably doesn't surprise you, but because inflammation is associated with so many conditions today, whether it's cancer, whether it's diabetes, whether it's pregnancy, whether it's autoimmune conditions or whatever. And one of the things they have found in autistic spectrum disorder kids that there's this very strong correlation of inflammation. And they've actually measured these inflammatory markers, as you can see on this particular list. And these are things to remember or look back on when you pull down these slides and show some of these deficiencies that we're going to talk about today and how they correlate to these inflammatory markers and why certain nutritional supplementation may help that and why it's important that we, once again, get these into the mother and father before, once again, they have children, is because it's very important that if a woman has diabetes and she has, excess inflammation, or she's overweight and she gets pregnant and she has this excess inflammation, or if she's highly stressed or the husband's highly stressed and there's certain things that are being depleted, that yes, you have a higher chance of autistic spectrum disorder. And this is very vast in the literature. This is not like one study. There's several studies that show that inflammation is associated with it. And once again, I'm going to show you some micronutrients that are associated with that. So it's very important. As I mentioned, one of the specific amino acids that they talk about in the literature, and I've also found on the cellular micronutrient analysis by Cell Science is with autistic kids, is tryptophan deficiencies. And most of the time when people think about tryptophan deficiency, they think about, sleeping, or they might think about depression, or they might think about anxiety. Those are the three big things that people think about. Once again, insomnia, depression, anxiety, right? But now we know that tryptophan is very important. And if you've listened to some of the previous webinars that I've provided, we know that tryptophan is very important for maintaining the digestive tract. That if you have a tryptophan deficiency, that you can actually cause an inflammatory reaction in the digestive tract, which could lead to so-called leaky gut syndrome and this whole schematic of the gut-brain axis. And so this is a very important nutrient. And once again, if kids are limiting their protein intake, which is very commonly found in autistic kids, they're more of a carbohydrate, they're more of a carboholic type of individual, and a lot of studies show that, then you're going to be limiting this. And of course, as we know, dairy products are a big concern, or a lot of people are avoiding dairy or they're avoiding gluten. And I'm not going to talk about that. That's Amy's section. But the point is that if they're limiting the foods that are high in tryptophan, now they're going to bring this about. And once again, I'm going to show you some correlations here. And this is where we talk about the serotonin levels and so on. So as I mentioned, they've found high serotonin levels in the blood, but when they've actually gone into the brain, they've actually seen decreased levels. And one of the things that's been correlated with it is right here in the third bullet, you can see is vitamin D inadequacy. And it's actually this particular enzyme here, the tryptophan hydrolase 2, that's been associated with it. And now there's other information that's saying, well, maybe there's some polymorphism with this particular gene that's associated with it. So now you have that 10 or 20%, once again, that's genetic, they say. But then you also have a nutrient like vitamin D, and we all know how common vitamin D deficiency is, not just in the United States, but worldwide. And one thing I can tell you that I see a lot of vitamin D deficiency in women that come to me for fertility. If you go into the fertility information, that there's evidence to show that vitamin D supplementation improves the egg quality as well. So here, not only does it help with egg quality, and a lot of, I don't say a lot, there's several infertility clinics I hear that, will promote vitamin D supplementation prior to IVF and things like that. And it makes a lot of sense because a lot of these women are deficient in vitamin D. But now, by doing that, you're going to possibly attack this enzyme or help with this enzyme, unless the person has some genetic variants on this. And once again, that's where you'd have to test that. But once again, it would be beneficial right away to help with that vitamin D. So there's a connection there. So once again, we're looking at serotonin, one area of the body, the blood, and then another, we're looking at the brain level of serotonin. And once again, here comes a connection with vitamin D. And once again, as I mentioned, very common. Well, what about oxidative stress? We talked about inflammation. Now we hear about oxidative stress as a major cause with a lot of diseases as well. Well, here we go, is ASD has also been associated with oxidative stress. And you can see here, once again, vitamin D comes into play because it helps with this particular enzyme, the glutathione peroxidase 1, and how that helps reduce oxidative stress. And they have found through research, and I cite an article here, even though there's several articles I could have cited, that the glutathione redox imbalance actually does have a role or a part to play with ASD. And if we don't have that balance, then we have some, pro-inflammatory cytokines. I used to have an office next door to an OBGYN, and she was very functional. She's still very functional here in Houston. And she told me one day, she was, Ron, I'm finding out that a lot of these pregnancies that are difficult pregnancies, when I draw blood on these women, a lot of them have glutathione deficiencies. And I find that when I balance out or I correct their glutathione deficiency, that their pregnancy improves the next several months. I thought that was very interesting. And I heard that several years ago, probably 15 years ago, when she was next door to my office. And so here's some literature that supports that. So once again, we talk about glutathione, we talk about NAC, various things like that, but here we have a connection of vitamin D. And as I mentioned before, some people say that 80 to 90% of the world population has an insufficient, not so-called a true deficiency based on serum, but has an insufficient amount of vitamin D. So what's the maximum? I mean, what's the, Most people, if you practice functional medicine, a lot of you say 50 to 80 or 60 to 80, 60 to 90, and so on. And I have to agree with that. I mean, I see that as well with people that do better, once again, have that particular type of situation. So here's kind of a summation of some of the benefits of vitamin D. And they've shown, like I said, in epidemiological studies that vitamin D deficiency has been, once again, shown to be involved with ASD. Calcitriol, as you all know, is a neuroactive hormone. It's very important for brain development and cognitive development as well. Then, of course, you go down here to the third bullet and talks about the transmission of the neurotransmitters. And then, of course, the regulation of the inflammatory process with, once again, vitamin D as well. Because, we used to think vitamin D was just for bone. If you had vitamin D deficiency, you got rickets and that was it. Now there's so many things associated with it. There's 1,000, well, depending upon who you read, there's anywhere from 900 to 1,000 genes associated with vitamin D in the body. So it's a huge comparison. This is a great article in Nutrients in 2021. You can see here, they kind of summarized this particular relationship that if you do vitamin D3 supplementation, and they looked at these different ranges, 2,000 or 5,000, and they showed that, of course, the severity of ASD was less, and then they kind of take you through as far as some of the mechanisms that I already talked about and why it's important to do that. And once again, don't wait till you have a child. I mean, get ready before you get pregnant and really emphasize that is very, very important. So another nutrient that has been talked a lot about as far as neurodevelopment, and there's a terminology, as you all know, in neurology called neuroplasticity. And zinc is all over that statement, that zinc has an impact on neuroplasticity, but there's several things that zinc does besides that. But you can see here that there's a high occurrence of zinc deficiency. As you can see here, almost 50% of the children that were listed in some studies show that there's a zinc deficiency. And once again, huge for development. Now, what's interesting about this, and this is real important as far as nutrient, is high dosages of folate or folic acid can actually affect zinc levels because they do have somewhat of a competition in the GI tract. Now, there's some, controversy on that, but I can tell you that's very true in a lot of cases. And I see a lot of leukonychia in women, like in the mid to latter part of their pregnancy. And of course, that's highly correlated with zinc deficiency when they display that. But we all know there's a balance between copper and zinc, and there's a ratio that we look at zinc to copper, and usually we want it to be 10 to 1. Some people say 7.5 to 1. And once again, some people say you don't want to go above, of course, 15 to 1. Here's a really good article that was published in Neuroplasticity in 2015, and they took you through some relationships of how zinc is so important to the gut-brain axis, and they show you the different mechanisms and relationships and why it's so important to really address zinc. And like I said, most of the time, people don't look at that in that aspect. And zinc deficiency causes anemia. It causes the same presentation on the CBC as an iron deficiency. It does, it decreases your MCV. It can decrease your MCH and your MCHC just like an iron deficiency can. And so when people look at CBCs, when a woman's pregnant, say, oh yeah, you're anemic, let's give you iron. Well, if you keep loading iron too much, of course, it can interfere with zinc absorption because of the, divalent cation interference. But it can also mask that. So if you load up enough iron and a person has a zinc deficiency on a CBC, but you don't know that because you just have a low MCV, you may actually mask that. So once again, something that you have to look at. And that's where you see this in the middle here where it says the iron, the copper, the calcium, folate, those things can interfere with zinc and cause some of these problems. One of the big things is environmental toxicity, of course. We're all concerned about that. And, we want to make sure it's so-called organic. It doesn't have these pesticides and heavy metals and things like that. So what's important about that is that this particular product here, metallothionein, this product is related to zinc. This product is a detoxifier in the body. So if we are low in zinc and we can't produce this particular product, then once again, we don't detox well. No, so it's not just like the methylation pathway, but also this particular function as well. So if you think there's a heavy metal, like cadmium or lead or mercury or something like this, zinc is very important for this particular structure as well. Then there's more evidence about some genes that are associated with zinc. And you can see this gene here, the SHANK3 gene, has been associated with ASD. And we actually know now that zinc supplementation may restore the SHANK3 mechanism or relationship, I should say. And once again, could help with the neurological development and function of that child. So once again, another reason why we want to know the zinc status of the woman before pregnancy or early into pregnancy. And once again, keep track of that particular mineral as well. And so here's a correlation of all the things that are more or less associated with zinc and autism. And this was, as you can see, a pretty new article published in 2023 in Nutrients, excellent journal. But you can see it helps with exposure to toxic metals. The severity of ASD is affected by zinc. The food selection, once again, zinc is highest absorbed from animal products. Okay, I know people say, well, I'm vegetarian and, and I can get zinc from beans and I can get it from various sources. Yes, but the bioavailability, and this is not my belief, this is in the literature, the bioavailability of zinc from plant sources is about 10 to 15%. The bioavailability of zinc from animal sources is about 60%. So you have about a 6-fold improvement of getting zinc out of an animal product than you do out of a plant product. But if if you are vegetarian and you are more prone to zinc deficiency, of course, that's when supplementation comes into play. So I'm not trying to convince anybody not to be vegetarian. I'm just saying those are the facts. And so once again, you can see that it's connected to the GI and of course that SHANK3 that I talked about and the overall neurodevelopment. So how much zinc do we need? Well, you can see here, metabolically requirement is about 2.5 milligrams per day, which is equal to about 10 to 15 milligrams of zinc. Well, when you get pregnant, you have to add an additional 5 to 10 milligrams. So now we're talking about 20 to 30 milligrams of zinc. Most prenatals have 10 to 15 milligrams in them, okay? We say, well, yeah, you can maybe make up the other 10 or 15. Well, do you want to take that chance that you're going to make it up, or you're going to test and see if the person is zinc deficient? And then, of course, when the woman gets into lactation, then, of course, you can see there's another additional 2.5 milligrams per day that are required. Iron deficiency, very common. You can see here it affects almost 50% of children in certain areas of the world. Iron deficiency has been associated with autism. Once again, iron deficiency presents the same way as zinc deficiency on the CBC. So there is no way that you can just look at a CBC and say, oh yeah, this person needs iron. It happens all the time. I know some of you see that in your practice. I see it all the time where a person will come in and they have a low MCV and low MCH or MCHC, and the physician says, oh yeah, I was put on iron. I said, well, how did they convert it? Did they do an iron profile? No, they didn't do an iron profile. So they just guessed. And that's what you're doing. You're guessing, okay? There's no way that you can do it unless you do some other specific testing. So how does iron come into play with the nervous system? You can see there's several roles of iron. And once again, it's something that's very commonly deficient. And once again, even when the child is born, it's very commonly deficient or continues to be deficient because of the selection of the foods, either one, because of intolerances, or two, because, like I said, they have a high tendency to go more towards the carbohydrates. But you can see here, whether it's neurotransmitters, whether it's structures, whether it's the myelin or the astrocytes or whatever it is, there's several roles that iron has in this particular one. And if you have a woman that's hypothyroid, she often has an iron deficiency. And once again, that either further compounds it. So here's some neurotransmitters associated with iron. And once again, we know that they're very important. And one of the things that they have found with a lot of autistic kids, and if you deal with this, you already know this, but a lot of autistic kids have sleep problems. Their whole sleep-wake cycle is off. Of course, we know the other things about the attention, the memory, and some of the learning. But one thing that's talked about quite a bit is, once again, the sleep cycle in these individuals. And of course, serotonin has a big role. So there's an enzyme, of course, called tyrosine hydroxylase. And this is the one that is iron dependent. And once again, you can see this helps make dopamine. And so it's very, very important for the dopamine synthesis, and this is the role that comes into play. And this is why you see some kids that have ADD, they're iron deficient. When you give them iron, they get better. It's because of the dopamine relationship, right? And that's in the literature. And we do know that ADD or ADHD is associated with autism as well. So when we look at these particular things, you can see all the things that we have to look at with the metabolism of autism. And you can see on the left side here, it's not just the emotional things that we look at, but we've seen epilepsy, we see GI problems, we see the stress involved, we see the inflammatory, we see the eating behavior disorders that we see. Cardiovascular disease comes into play, and part of it can be the homocysteine relationship. And then you look to the right of that, and you can see the minerals involved. We talked about some of the minerals, the probiotics come into play, the vitamins and the roles that they come into play. And once again, very, very important. So this is my last slide, but this will lead you into, once again, Amy's lecture, because I think it's very important that you see what she has to offer and how a big role that particular plays. But look at this. In one study or a couple studies, they showed that 8 out of 10 kids have GI problems, that have ASD. And about 25% of children are diagnosed with at least one digestive problem, whether it's diarrhea, whether it's constipation, whether it's vomiting, GERD, whatever. So it's a huge, huge factor. And this is going to lead us into, once again, Amy's lecture and how food sensitivities come and play a role.
Thank you so much, Dr. Grabowski. That was excellent as usual. As Dr. Grabowski mentioned, there are so many contributing factors to autism, and we really, as he said, is just skimming the surface with what we discussed tonight. But what I will be discussing is the use of the ALCAT test to take the guesswork out of what foods to eliminate from your patient's eating pattern, including your patients with autism. Okay. So with all of our patients, we always take a step back and consider, is this person's brain and body receiving everything that's necessary for optimal function, as Dr. Grabowski discussed? And also, is there something or, some things, a number of culprits entering the system that interfere with optimal function? So, what culprits would we need to remove from the patient's eating pattern, from their intake, or from the environment? Okay. So, and that leads us all, of course, to consider gut health. We all know it starts here, and it really has been recognized for quite some time that there is an association with increased intestinal permeability or leaky gut, and the complications that you see represented here, including immune activation and neuroinflammation. When the gut barrier is compromised, poorly digested food particles, toxins, and bacteria and so forth can enter into the bloodstream, and that triggers inflammation and immune reactions. So this might contribute to, of course, digestive discomfort, but also fatigue, brain fog, anxiety, and so on. And then this chronic inflammation does tend to worsen gut health over time, and this creates a cycle of digestive and immune system imbalances. Okay. And leaky gut may play a role in autism by allowing these harmful substances and inflammatory compounds to enter into the bloodstream, and these substances could affect brain function. And research has found that many people with autism have gut issues, as Dr. Grabowski mentioned, including a weakened gut barrier and imbalanced gut bacteria. So this is just what the previous slide actually was, just a handful of studies that have made that connection. And then this slide you're looking at here is just, as you know, leaky gut has been linked to both digestive and whole body health issues. It's not always clear, though, whether it causes these conditions or it results from them. We do really think it's both. In every case, of course, is different. But what you're seeing here is just really a summary of factors. I consider them reminders of what can contribute to intestinal permeability and what we might need to address and remove from the patient's eating pattern or environment. Okay. And then to state the obvious, of course, since our intestines are in constant interaction with food, what we eat certainly does play a significant role in regulating this, the intestinal permeability. And there have been various compounds in food that have been shown to disrupt tight junctions, increasing that permeability, and the malnutrition, nutrient deficiencies, as Dr. Grabowski discussed tonight. But also, Dr. Grabowski, you might remember, did a leaky gut webinar last year in August, so you can certainly access that recording. But anyway, these nutrient insufficiencies mentioned can quickly and significantly compromise the gut barrier, which further exacerbates the gut dysfunction. Food sensitivities, of course, is what we're going to be talking about, such as reactions to gluten, dairy, other common foods do contribute to the weakened gut barrier. And immune system responses, nerve signals from the gut, harmful bacteria, they further damage the gut lining. Okay. So we're familiar with the 5R program, this framework that was developed by the Institute for Functional Medicine. Kind of, for me, just kind of acts as I love it. It acts as a sort of checklist to make sure we're covering all bases to heal a leaky gut and address the impact that poor gut health has on the body and the brain. So, and I really think that we can apply this to really all of our patients. And as said, you know, what we eat has a significant influence on the gut health. So a clean eating pattern based on, you know, whole foods can be a big help in and of itself. But I think we all know patients who appear to be doing that and they're still struggling, and including, you know, parents appearing to, you know, trying to feed their children in a healthy manner, but still struggling. So we have worked with many parents who do quite well, actually. So in other words, you know, taking the guesswork out of determining what to remove from the eating pattern is going to be very helpful. So the 5R program: remove, replace, reinoculate, repair, and rebalance. And for us, with working with food sensitivities, we add another R to that, called for reintroduce, because we eventually want people to be able to reintroduce their previously reactive foods. But removing, what do we need to remove? Well, we're going to focus on the food adverse reactions to foods here, but also, as Dr. Grabowski mentioned, pathogens, pesticides, environmental toxins. Of course, stress certainly impacts the gut. We need to remove stress. But what do we replace with? We would replace with a variety of non-reactive foods. We might need to replace digestive enzymes. For some people, we might need to give a little bit of acid support. And of course, repleting, another R, repleting those nutrients that are insufficient, that you've determined are insufficient from the cellular micronutrient assay. Reinoculate, looking at the gut bacteria or the yeast. Maybe we need to address candida. But again, encouraging friendly bacteria in the gut with prebiotics, probiotics, fiber, fermented foods if possible. And then, of course, repairing the gut with those gut healing nutrients, omega-3s, zinc, as Dr. Grabowski mentioned, vitamin C, vitamin D. And then rebalancing, you know, stress management, deep breathing. Of course, you know, yoga maybe helps, but for children with autism, of course, different therapies are implemented, such as music therapy, equine therapy, aquatic therapy, things like that. But all of these are gut healing strategies put together. But tonight, I'll really just be focusing on the remove part of the 5R program. So if we take a look here, this reference you see here was the first one, 2002 single-blind randomized controlled trial that investigated the effects of a gluten-free and a casein-free diet on children with autistic syndromes who were exhibiting urinary peptide abnormalities. It's a study on 20 kids. They equally divided the group into a control group and then the special diet group. So over a course of a year, pre and post and during, they, conducted some assessments, but at the end, they concluded that, the gluten-free, casein-free diet showed significantly greater improvements. The children following that diet, significantly improvement in behavior, interactions, and communication than those in the control group. So, but, you see another reference here, but most of the research that's associated with food culprits to consider removing from the eating patterns of those with autism, it's all mostly on gluten and casein. And really, this is one of the most popular dietary strategies that parents try to implement, is a combination of a gluten-free, casein-free diet. And of course, centered on leaky gut, as previously described. But with the intestinal permeability, allowing gluten and casein peptides to leak from the gut, they promote opioid activity, resulting in these autistic behaviors. So that's why really most of the focus has been on gluten and casein. Okay. While some studies show the strong improvements using a gluten and casein-free diet, others are really finding no significant change or benefit, really. So that suggests that gluten and casein are really not the only problematic foods. So this really does support the need for food sensitivity testing to individualize the eating pattern, rather than assuming, gluten-free and casein-free is all we need to do, and it's going to be sufficient for all children with autism. Okay. So what is the ALCAT test? As you know, there are many adverse reactions to foods. There's really no one test that identifies every adverse reaction. And I really don't want to sound like I'm oversimplifying this, because the immune system is very, very complex. But I always want people to understand, doing this test, that this is not an allergy test. A true allergy response tends to produce symptoms immediately after ingesting the offender, or within a couple hours of ingesting it. And the symptoms usually are, pretty significant, right? So this is not an allergy test, and it's very important that if you're using this test on your patients, or anyone doing this test, it's important that they realize it's not an allergy test. So if the person does have true allergies, let's say to shellfish, does not matter what the ALCAT test will say about that shellfish, the person needs to continue to avoid it. So it's important to make sure that that is explained to the patient. The ALCAT test is a sensitivity test. Now, sensitivity symptoms, if they are noticed, can happen hours after ingesting the offender, and anytime up to and including 4 days later. So they can be very delayed. But symptoms that would be coming from a sensitivity, they do tend to be more chronic. And many people who will be doing this, do this ALCAT test, will say GI issues, constipation, diarrhea, extreme fatigue, skin issues, brain fog, attention deficit, weight struggles, the list goes on, but it tends to be the symptoms or the struggles tend to be more chronic, of course, not immediate type symptoms. The ALCAT test is a leukocyte activation test. It is not testing antibodies. It is not testing cells of the specific immune system. It is looking at mostly cells of the innate immune system. And looking at, I'll show you a sample test result a little later, but it can test, I think it's up to 500 and some substances. But this, chronic widespread inflammation, just like Dr. Grabowski mentioned, contributes to numerous disorders, including the list that you see here. And we really do feel that this ALCAT test is really one way to determine what the person is ingesting that is leading to inflammation. Okay. I like to show this graphic to everyone who I'm just starting to review ALCAT test results, especially, practitioners who are starting to use this. This, again, it's a leukocyte activation test, and because the neutrophils are the most abundant white blood cells, they're mostly neutrophils that are tested. And this is just showing you the intact white blood cell on the left, the far left there. When there's a test agent, you see the trigger into the cell, test agent that is put into the specimen. The ALCAT test is measuring the change in the number and the shape and the size of these white blood cells. So what this is showing you is that what happens when the cells are reacting, the inside of the cells, you see those, the red, they're like granules, they call this degranulation. They're really being released into the outside of the cell. So they're essentially bursting open really and releasing these inflammatory substances into the gut. And then of course with leaky gut into the circulation. And then you see all of the symptoms and the issues that can be associated with this neutrophil response, this white blood cell response. So I always point out to practitioners, especially utilizing this test, to show this to their patients, because when the patient looks at their test results, very common comment I might hear when let's say almonds were severely reactive for a patient. It's not unusual to hear a comment for any food really, but oh, come on, I eat almonds all the time. I don't have a problem with almonds. And my response is, well, yes, that's exactly the point. You do have a problem with it. This is what's happening when you consume these almonds. This inflammatory response. And then I have to remind the patient, well, what made you get tested in the first place? Oh, I have this major digestive issues. I have major migraines. Exactly. So, but when people say that sort of thing, they're looking for symptoms that would happen immediately after ingesting those almonds. And that would be more like an allergy, not this inflammatory response. So if you look though in this, where the arrow pointing, out to what's being released from the cells, but then you look in this, the blue rectangle there is telling you what is being released from the cells. So just looking like Dr. Grabowski mentioned, inflammation, the cytokines, the interleukins, right, the chemokines, a lot of patients nowadays are familiar with those because they learned about them during COVID. So I point that out to people. But also, you see mitochondrial and nuclear DNA, that's being released from the cells. And it's actually the Yale School of Medicine, they were the first to determine that when they studied the ALCAT test. So highly inflammatory when it's on the outside of the cell. And then the reactive oxygen species, we talk about oxidative stress and the oxidative stress that's happening in children with autism as well. Well, this neutrophil response here, you see back up to that cell, that's, you see right underneath, it says ROS and net formation, degranulation. ROS, that's the reactive oxygen species, those free radicals. So the neutrophil response is one of the biggest contributing factors to that oxidative stress and to, of course, inflammation. And then I always like to say this too. There are people who, from time to time, they do the ALCAT test just for the heck of it. And, my team and I, we find it that those patients are probably the most difficult to motivate to follow their results because they don't feel that they're symptomatic. So that person I would definitely show this to and say, remember, this is inflammation happening. And how do we always feel inflammation? But inflammation is one of the biggest contributing factors to the health problems in our country, right? And of course, autism. So, but how do we always feel inflammation? We don't. So this is why I really feel this test would be a wonderful test for all of us to do. And then you always hear about what is the best anti-inflammatory diet to follow? You see that question all over the internet. Oh, what's the best? Well, of course, the Mediterranean diet has the most research, but I would say it's really the eating pattern that's going to be generated from consuming your non-reactive foods and avoiding your reactive foods identified by this test. To me, that is the best anti-inflammatory eating pattern, is the one that is individualized for you. So again, this graphic, I always remind people, remember this, even though you don't feel like you're symptomatic, remember this inflammatory response is happening whether you feel it or not. Okay. Now, there's a lot of research been done on the ALCAT test over the years. I want to say at least I believe the LCAT test almost 40 years old, really. A lot of enhancements over the years. And I think a lot of resources have been done on this test over those years, and even recently. So tons of it. And you could find a comprehensive overview on that scientific research included in the scientific dossier, which you can find on your resource section in the on the Cell Science Systems portal. And then, but since that dossier was published, more research being done since then. But when it comes to autism, research is you know, using the LCAT test on autism is limited, but this one was done, now it's a long time ago, it was back in 1988, but what was done here is they took, you know, it's multidisciplinary, of course, there's a lot, not just nutrition, but you know, other therapies. But 12 children and 11 boys, 1 girl. The assessment tool was the CARS, which is a tool that the parents needed to fill out as far as their child's behavior. And then the way they identified adverse reactions, they did RAS testing to test allergies and the LCAT test to test for sensitivities. And then you see the behavioral criteria that was evaluated there. Okay. And then, of course, the nutrition intervention was removing the adverse food reactions, removing the allergies, removing the sensitivities, encouraging a balanced eating pattern. They also did supplement according to individual deficiencies. I don't know what test they used to determine the nutrient insufficiencies, but they did supplement and replete those. And of course, they coupled that nutrition plan with this structured auditory exercise over a specified period. And then you see the outcomes. So this was it had a very positive impact on all those outcomes there for these 12 children. And interesting that, excuse me, you might remember years ago, Dr. Feingold, you know, the Feingold diet, you know, he brought up how 50% of his patients with ADHD saw a major improvement by eliminating food additives and dyes, but also salicylates in foods. So it's interesting though, all of these 12 children, 100% of them reacted to the food dyes, and 67 to 100% had reactions to various foods and or molds. Not everybody reacted to the molds. So anyway, it just showed that this was actually, you know, it underscores the importance of a personalized treatment plan. Now this next study, the next slide, this one was not done specifically on autism, but this was presented at the annual meeting of the American Academy of Allergy, Asthma, and Immunology, again, long time ago. But what they did was they looked at the correlation of the LCAT reactions of the food dyes and additives with double-blind placebo-controlled oral challenges, and the correlation was 96%. There was really only one false positive out of the whole test, so it's really considered quite accurate. And they said in the study too, all the symptoms that the study subjects reported, they all were all resolved after removing their reactive additives. And my understanding when it comes to these chemicals, these additives, is that they're too small to generate antibodies. So if you would like to test your patients on the reactivity to the different dyes and additives, this would be the test, the best one to do that. Okay. Now, you know, we have worked, you know, in PreviMedica, you know, again, as you know, I oversee a whole team of nutritionists, and we have worked with clinics in the past who solely work with children with autism, ADD, ADHD. And they combined the what they call functional neurology-based therapy with nutrition therapy. So we provided the nutrition therapy for their they call them students, actually. We provided the nutrition therapy, but they first did the LCAT test. So here's one case. This 5-year-old little boy was diagnosed with high functioning autism and Asperger's. Not a good sleeper at all, woke up many times during the night. Parents would report that he was really grumpy and moody and lethargic, argumentative, defiant, especially when, worse when he didn't get much sleep. Had very little interest in eating. Not unusual for children with autism to have a heightened sense of smell and or taste. He had a heightened sense of smell. He would smell everything before he would try it, or, whatever. That would determine if he was going to eat something. Constipated, only went to the bathroom, only had a bowel movement twice per week. Not unusual for children with autism, and really was not willing to try new foods. When they started working with us, parents had reported that he was already participating in what they called a social group and doing speech and language therapy. At that point, they had not really noticed much improvement. And there's this food intake. He accepted less than 20 foods. Parents considered him a picky eater, and we actually we actually considered him a problem feeder. I mean, we didn't necessarily say that to the parents, but in other words, accepting less than 20 foods, that's really significant. And you see what his repertoire of foods was, not real health promoting, really had no interest in vegetables, and was not drinking a lot of water. And that in and of itself could be a problem with the constipation. And then his multivitamin was Flintstones chewable. So you can imagine that, yes, here's the intervention, but you can imagine how difficult it is for us when we are trying to remove our reactive foods, because we like our food. So you can imagine how difficult it is for families, parents who are trying to feed their children, and especially children with autism, that it's not as easy to say, okay, now you can't have this. We're taking away the gluten, the dairy, and a lot of your favorite foods, actually. So it's not going to work overnight, obviously. So what we did with this group of people, this case included, is we started with going over nutrition basics and trying to expand the child's repertoire of foods, promoting positive eating, giving suggestions to the parents how to do this to expand the repertoire, and at the same time with offering more healthy options, less unhealthy options. We very often had to use an approach called food chaining, which you might be familiar with. This is just kind of like a step-by-step approach to eventually getting the child to accept what you want them to accept. And for taking an example, it could be, let's say somebody was eating chicken nuggets from McDonald's. All right, so maybe, we offer a chicken nugget, but it's a different brand or from a different fast food restaurant. And then the next time you order, you maybe change, order, or offer a brand from the freezer, right? Next time, maybe you offer a different shape of that. So you are changing what you're offering ever so slightly until you get to that baked chicken, what you really want your child to accept. So we did a lot of that, and that's what we did first with children like this. And then in the meantime, they got their blood work done to have the ALCAT test done. We worked on expanding the repertoire of foods, and then we go over the ALCAT test and help with that. So next slide. So these were his reactions. He had more reactions than what we have listed here. You see the severe, they assign a degree of reactivity, how much these foods change the number and size of the white blood cells. So severe, moderate, and mild. These were the ones that he was actually consuming prior to the test that mom and dad had to work on getting out, but he had other reactions. So the plan was remove all the reactive foods. We worked on, of course, gut healing, and we replaced with a variety of non-reactive foods. We did have to suggest digestive enzymes, probiotics, and of course, a much better multivitamin mineral to replace the Flintstones, and omega-3 fatty acids. So okay, next slide. The progress. Now, as you can imagine, there's always ups and downs with, anyone, and providing nutrition therapy and, having them, take your suggestions. There's ups and downs, so we did have some setbacks. where, there were some meltdowns with, during the, what the parents were doing with food chaining and removing reactive foods and so forth. But ultimately, at the end of our work together, the parents reported that he was trying new foods, is much more interested in eating, accepting more vegetables, drinking more water, eating more overall, gained weight, which is they desired that because he, was a little underweight. He was going to the bathroom daily, so that was major. Sleeping longer, no more meltdowns. Parents described him as having a pleasant personality, and definitely improved communication, and it just appeared happier overall. And they made a point to say he was asking us now for hugs, which he never did before. So that was a wonderful progress, wonderful success story there. Okay, another case report. 4-year-old female with autism. Of course, her symptoms were behavioral issues. She was very inflexible. She was biting and hitting and kicking, wetting the bed every night. She also had a hypersensitivity to smells. She was constipated. She didn't go to the bathroom more than every other day. She was considered a picky eater. She had texture issues. And again, not unusual. Mom said that she would prefer only crunchy foods, and she preferred to eat alone rather than with others. So we thought that was interesting. Now this, for her food intake, probably doesn't look that great, but it's better than most, because Mom and Dad were only shopping at Whole Foods and Trader Joe's. So even though these don't look so great, it was, let's say less unhealthy options than you might expect. And she was drinking a good amount of water, and parents were doing a great job with avoidance of dyes and preservatives. Taking a gummy vitamin, of course, without the dyes, but still had sugar in it. So then the intervention, okay. Same thing, the same therapy that the center would provide. And then we did the nutrition basics, promoting positive eating, encouraging more of a variety, expanding her repertoire of foods. And then we did the ALCAT test. Okay, so then these were her reactions, and the ones that are bolded, these were all her reactions actually, but the ones that were bolded here are the ones that she was consuming that we really had to remove. So you see, dairy, gluten is there, but like also apple, banana, cinnamon, cocoa, corn, yeast, baker's yeast, oat, so almonds. So I mean, there was quite a bit to help her remove. So we did remove the reactive foods, work to heal the gut. We did supplement with probiotics. We suggested probiotics, multivitamin to replace the gummy, and omega-3 fatty acids. Again, setbacks. Okay, if we go to the next slide, setbacks with her, because she apparently had a bunch of meltdowns with during this program. So we kind of had to start over a little bit, but eventually, her parents reported that she was going to the bathroom daily, had much more energy. Her behavior was more balanced, no more hitting, no more biting, trying new foods, accepting new foods. Mom no longer considered her picky, and she appears healthier overall. Her, relatives and friends and neighbors were commenting on how much healthier she looked. She never did accept the supplements we suggested, however, except for fish oil, which was interesting that she accepted fish oil. So those were some nice success stories there. This here, I know is small, but this is a sample test report, sample of the ALCAT test. This is just the first page. And what you see on here is 250 foods. So 250 foods reported. Every food is reported. Every test agent is reported one time in the ALCAT test. So 250 foods. There are many, many different panels that you could choose from. But I could tell you, if I had my way and you asked me what to test, I would say do the 250 food panel plus the 50 functional foods and medicinal herbs, at least, especially if you're doing the cellular nutrition assay along with the ALCAT test. And that's because in the 50 functional foods and medicinal herbs, a number of the antioxidant botanicals that are tested in the APA are also tested in the ALCAT test. So you want to be able to refer to that to determine, okay, this came out to be this acai berry came out to be protective for you, but let's just make sure it was not reactive in the ALCAT test. So that's why I would suggest at least the 250 foods plus the 50 functional foods and medicinal herbs. And of course, you have the additives panel, you have a molds panel, you have antibiotics and anti-inflammatories if you want. So there's all sorts of different things. I think they're testing now up to about 500 substances. So you see, though, they reported the degree of reactivity. I always start with the good news first in the green there on the right, because that is really the repertoire of foods that we want to be that we want this patient to be focusing on, is what you see non-reactive in the green. And then you see the severe, moderate, and mild. Severe would be general recommendation. We of course like to individualize, but in general, 6 months or more avoidance for the severe list, 3 months or more for the moderate list. We tend to rotate the mild list into the eating pattern. And then you see on the bottom of the page that Candida is tested, gluten, gliadin, casein, whey, and lactose. They get their own boxes because when they are reactive, they require the elimination of more than one food. So they need room to put those foods into those boxes. So that's why they're at the bottom of the page there. So this is just, it's a very simple report, and this is what it looks like. Okay, next. So this study, this is just a case study on one boy with moderate autism. Dr. Grabowski came across this, and what they did was 3 years, because there's another example of it, how long it could take, 3 years of following a healthy diet consisting or including pumpkin and walnuts. And I examined this in this review of this little boy with autism. And of course, during the years, they did a lot of assessments and biomarkers and observed clinically, and looked at the markers for inflammation, neuroinflammation, and oxidative stress, and the microbiota composition and mitochondrial dysfunction and so forth. And what they concluded is that that this emphasis on walnuts and pumpkin for this little boy did offer some therapeutic benefits. So they're saying maybe consider this for others as well. And why might this have happened? Okay, so, decreasing of the oxidative stress and the neuroinflammation. Look at the health properties of walnuts. They're rich in omega-3 fatty acids and antioxidants and polyphenols. So of course, with helping with the anti-inflammation and neuroprotection. And the pumpkin, good source of fiber and antioxidants and vitamins A, C, and E, helping to reduce oxidative stress, right? And support, of course, gut health. And once again, anti-inflammation. So this was I thought, very interesting report. And what I would suggest when you think about something like this, though, is this would be awesome. However, what if walnuts are reactive in the ALCAT test? What if pumpkin is reactive in the ALCAT test? So rather than being anti-inflammatory for that person, they would be pro-inflammatory. So I would say, focusing on foods that are really good sources of antioxidants and omega-3 fatty acids and fiber and so forth. However, ones that are shown to be non-reactive in the ALCAT test. Okay, then this one, you might not realize that the Cell Science Systems Cellular Nutrition Assay also includes this, the redox score. So we heard us mention, both Dr. Grabowski and I mentioned about oxidative stress. Well, I would highly encourage you to utilize this part of the cellular nutrition assay as well. That redox score there, that number 78, that's telling the antioxidant capacity of this person's cells. And here again, remember, when someone is consuming their reactive foods, that right there could be impacting their redox score, because that neutrophil response is leading to the oxidative stress. So then I would suggest doing this, but also look at the antioxidant protection assay underneath it. this test is taking a step further by not only saying, yeah, we need to improve this redox score, but which antioxidant botanicals or nutrients would work to be the most protective antioxidants for this person, rather than guessing. So this is why I said this test, but also couple that with if you're coupling this cellular nutrition assay with the ALCAT test, it would be a good idea for you to make sure that you're doing the 50 functional foods and medicinal herbs test panel as well, to be able to cross-reference and make sure that the antioxidants that you'd like to suggest are not reactive in the ALCAT test. Okay, so that takes care of it for me. Questions? All right. I don't see any questions coming in. Dr. Grabowski, there's anything else that you wanted to add?
No, I just want to say that, like I said, I think it's very important based on all the literature out there on, like you said, Amy, about the, reactive oxidative species and inflammation and all that, and really finding out what particular nutrients are best for that particular patient based on the vitamin, the cellular micronutrient analysis, because that's so important. It's not just say, oh yeah, well, I know that NAC or glutathione is good, but is it good for this particular person? And like I said, in taking out the reactions. And one of the things that's really emphasized in the autistic literature with nutrition is how, and Amy really showed this on a couple cases, is how picky these kids are in selecting foods. That one, it could be texture, two, it could be smell. They're very, like she showed us, and this is so true and documented, on how hypersensitive they are to foods and texture. And so you have to work around that. And that's why I was telling you, as well as Amy was mentioning, that this is a long process and parents have to be all in. They have to realize that this isn't going to happen overnight. You're going to have some ups and downs. You're going to have some fight back from the kids, but the end justifies the means. And so we just have to keep fighting. And I think what hasn't been talked about in the literature, early in the literature, like in the 80s and 90s, was specific nutrients that heal the GI tract. And now we know, in the last 2 decades, on the glutamine, the tryptophan, the cysteine, the vitamin A, so many nutrients now we know are instrumental to the healing. So it just complements the LCAT test. And it's like how I explain it to patients is, it's like you have a blister on your hand and you keep rubbing the blister. Well, it's not going to heal, and that's the constant irritation, and that's the ALCAT test. Once you remove that rubbing, which would be removing the sensitive foods, you still have to have the nutrients to heal that ulcer. And so if you remove the irritant, but you don't get the nutrients to heal that ulcer, it's not going to heal. So it's a combination, and that's where parents have to be all in. But also, as I mentioned earlier, pre-pregnancy, is the woman vitamin D deficient? Is she zinc deficient? Is she iron deficient? Get that tested before they start having children, and it can help a lot with the neurodevelopment.
Right, absolutely. Yes. It's very challenging, and it could take a long time for this. Question: the mention about we didn't mention actually anything about the dopamine pathway and autism. Anything to say about that, Dr. Grabowski?
Oh yeah, there's definitely a lot of relationship with the dopamine. Like I said, we have to look at the nutrients that are involved with that. The magnesium, the vitamin C, the copper. I mean, there's several nutrients that are involved with dopamine. And some of those, once again, are like B6. B6 is associated with dopamine. I didn't mention it, but it's associated with dopamine production, but also it's part of the methylation pathway. And it also has an impact on homocysteine. As I mentioned earlier, homocysteine elevations have been found in these kids. So we see some crossover there between a neurotransmitter, a metabolite that we can measure in the blood, like homocysteine, that gives us, and then we have the individual testing of specific nutrients, like the cellular micronutrient test, that really says, is that nutrient working inside the cell?
Right. Okay, and then this question with the antioxidant protection assay, does it change over time? And yes, Janet, it can change. And to be honest with you, when we first came out with this test and I noticed that, I remember going to the lab and saying, how could this be? This is changing. And I've kind of felt not too smart, because they said, well, the immune system and these are immune cells that are being tested is constantly changing. And of course, so much that it's changing, as far as the person's medical condition, health issues, and so nutrient status, all that impacts it. So yes, it can change over time. And a lot of times what I'll see is, first of all, what you want to see is the redox score going up, getting better. And then, but, sometimes you'll see, delta tocotrienol was very highly protective one point, and now it's, maybe in the baseline area, but, it was protected just barely, in the light green range. So it wasn't as protective. So that tends to be what I'll see, where the degree of how protective they come out to be may change too. Dr. Grabowski, you see that too, right?
Yeah, I see that as well. And one thing I want to emphasize, because sometimes, well, and this happens a lot, where a nutrient might not say it's protective or highly protective. And so people say, well, zinc's not protective or highly protective, so should I take zinc? Well, if the micronutrient test says you're deficient in zinc, yes, because you have to realize that that's just looking at the antioxidant relationship of zinc. You're also, there's over 300 functions in the body for zinc. So there's other things that zinc's required for. So don't think, oh, well, this doesn't say protect, that's why I really shouldn't take that. No, that's not what that's saying.
Right, exactly. We'll get that comment all the time, for example, coenzyme Q10, because a lot of people are taking CoQ10 and they'll say, oh, because it didn't come out to be in the light green or dark green. Oh, does this mean it's bad for me? I say, no, it's not bad for you. And there's certainly many other purposes, functions of coenzyme Q10. It just didn't come out to be a highly protective antioxidant. So I'll say, why are you taking it? Oh, because I read it was a good antioxidant. Well, I'll say, well, if that's the only reason you're taking it, maybe get more bang for your buck and take the ones that are protective, right? But, maybe this person's taking a statin drug, and that's why they're supplementing with coenzyme Q10, so there are other reasons. So absolutely, that's just looking at the antioxidant protection in that assay. So Dr. G, I don't see any other questions.
Okay. Well, like I said, just to emphasize again, this is a long process, and please talk to the parents of these kids and let them know from day one that, it's a work in progress, but there are some very exciting findings and correlations. And the sad thing is really on how it's increased in the last 2 decades. And I showed you on one of the earlier slides from 1 out of 150 to 1 in 36. And so there's a lot of things, a lot of factors that come into play. And that's why you really have to be a good clinician and start investigating all the different things. And like I said, that's why it's going to take so long on your part, as well as the parents being patient and introducing or being all in on the therapies.
Yes. And Dr. Grabowski, can you advance to the next slide? I just want to say one more thing.
Yeah.
So everyone, those of you who do not have an account with Cell Science Systems, here again, just go to this link here, connect.cellsciencesystems.com, and click on provider. You'll start a new account. Customer service team of Cell Science Systems is wonderful, very helpful. That's how you can contact them. And then, as you know, Dr. Grabowski is available to do the complimentary 30-minute education sections, reviews of the test results. And so are we in PreviMedica. And there's the link in order to schedule that. So when you test a patient, you'd like to go over their test results, you just click on that link. And if you prefer to meet with Dr. Grabowski, it'll take you. You'll see how you'll choose Dr. Grabowski and it'll take you to his Calendly link. And another question, yes, you will receive a recording of the presentation. That'll go out tomorrow night along with the slides. And Dr. Grabowski, next month, the last Tuesday of the month, right?
Right. Yep. And I have 3 or 4 subjects that I'm debating on whether or not, which one I'm going to pick. So we'll release that in the next week or so on what subject is going to be covered in March.
Sounds good. Well, I think that's it for the questions. Lots of thank yous. Thank you for all of you being here. It was our pleasure. And we hope to see you at the next webinar. Have a wonderful rest of your week. Good night.
Right.